Hi, I'm Elise with Coast to Coast TV. Today we'll be talking about HIV prevention and health equity with Dr. Kendrick Clack from Crowfoot MD Clinic and Research Center. Around 1.2 million Americans are living with HIV, and about 14% don't even know they have it. The virus continues to disproportionately impact women, Black, and Hispanic communities, and people who acquire it through heterosexual contact. Dr. Clack, many people may not realize there are medications that can help prevent HIV. Can you explain what PrEP is and why having more prevention choice matters?
So 4 decades into the HIV/AIDS epidemic, yet an average of over 100 people are newly diagnosed every day in the United States. Good news is we have tools that help prevent HIV. PrEP, which stands for pre-exposure prophylaxis, is a prescription medication people can take before they're exposed to HIV to help reduce their chances of getting it. Taken as prescribed, PrEP can be about 99% effective in preventing HIV through sex. Barriers like stigma, low awareness, and adherence all play a role in starting or staying on PrEP. That's why having more prevention options matters, such as long-acting injectables.
And can you talk more about this long-acting injectable PrEP option?
Of course. So long-acting injectable PrEP may help address some of the biggest challenges we see with HIV prevention, such as the difficulty some people have taking a daily pill consistently. Yes2Go, known also as lenacapavir, and developed by Gilead Sciences, who we're here on behalf of today and who is compensating us, is FDA approved as a long-acting injectable PrEP medication to help reduce the risk of sexually acquired HIV-1 in adults and adolescents who weigh at least 77 pounds. It is currently the first and only FDA-approved PrEP option that's one office visit every 6 months with 2 injections per visit after starter dosing. However, your healthcare provider may require additional office visits. You must be HIV negative to receive Yes2Go and get tested for HIV before each injection. If you think you were exposed to HIV or have flu-like symptoms, tell your healthcare provider right away. HIV testing may be needed. Yes2Go does not prevent other sexually transmitted infections. Practice safer sex and get Yes2Go as scheduled. Missing doses increases your chance of getting HIV. Tell your provider about your medical conditions if you're pregnant or plan to be, and all the medicines and supplements you take, as Yes2Go may affect some medicines. The most common side effects are injection site reactions, headache, and nausea. Rare, serious injection site reactions can occur, so tell your provider about any side effects. Ultimately, providers and patients should discuss the benefits and risks to determine whether Yes2Go or another HIV prevention option works best for them. And people can visit yes2go.com to learn more and view the important facts, including important warnings.
Who should consider talking to their healthcare provider about this new HIV prevention option, and where can they find out more?
A great question, Elise. So anyone who is sexually active should learn about HIV prevention options like Yes2Go and speak with a healthcare provider to determine whether it could be right for them. They can also visit www.yes2go.com for more information.